Wonderful. Okay, Greg, thank you so much for joining me today.
Yeah.
Gregory Wells is a licensed psychologist based in San Francisco. He's both a clinician and a researcher in the field of psychedelic medicine. He obtained his doctorate degree from UT Austin, and then he went on to obtain a postdoctoral degree in clinical psychopharmacology. He currently works as a principal investigator and therapist on the MAP-sponsored Phase 3 clinical trials of the MDMA-assisted psychotherapy to treat PTSD. He's also a co-founder of Polaris Insight Center, which is a cutting-edge ketamine-assisted psychotherapy clinic in San Francisco. Gregory has a long-standing interest in and deep respect for plant medicines and entheogens, and is eternally grateful for the lineage of healers and teachers who came before him and who make this work possible. Greg, thank you so much for the work that you've been doing and you're doing, and really excited to learn more from you. So my first question is, how did you get into ketamine-assisted therapy?
Yeah, first of all, thank you very much, Dina, for this opportunity, and thank you for your support of this important work. Got into the ketamine work really through the MAPS work. Once we started working on the trial, my co-founders and I, everyone works on the trial as well. We saw the amazing, healing potential of MDMA, and also felt stymied by the very slow approval process to get it through an FDA trial and bring it to market. And ketamine offers a viable kind of alternative, a legal alternative to that. And so we saw ketamine as a way to begin offering a very powerful new treatment to people who very much need it, and also as a way for us as a team to begin to kind of explore and prototype what a psychedelic therapy clinic would look like and how it would function. So we opened Polaris as a way to begin working with this immediately and begin to kind of explore this idea of a psychedelic therapy clinic.
Awesome. So if we just take a little step back, can you tell us what is ketamine-assisted therapy exactly?
Yeah, so I think that the answer to that is a little bit about the distinction between just sort of ketamine therapy or ketamine treatment and ketamine-assisted psychotherapy. And we think about them a bit differently. And you might think about it the way that many people who take SSRIs or the, sort of the main antidepressants on the market today, some just go to their physician, they get their prescription, they take their medication. Research seems to suggest that about a third of those people have some benefit from that. And many of those people are not working with a therapist. And then there are the people who take the antidepressant and they have a therapist that they work with regularly. And there's lots of research and several meta-analyses that have been published in the past that suggest that it's really the combination of psychotherapy and medication that works best, and that people get the not only relief but lasting relief. Mm-hmm. And so that's our approach with ketamine-assisted psychotherapy, that it's the ketamine itself is powerful and is a wonderful healing agent, but when combined with psychotherapy, we predict, and we're collecting research, and we're hoping that the research will support this, that really results in lasting change for people.
I see. And what percentage, if you can just sort of maybe estimate, out of the patients that are doing ketamine therapy, right, just the administration of the medicine, what percentage is just doing the administration of the medicine versus how many people are actually, also getting the psychotherapy along with it?
Yeah, honestly, I don't know that I have an answer to that question. I think there are far greater numbers of people being treated in sort of with just the ketamine therapy. There are a lot of infusion clinics around the country that are offering that sort of treatment. I'd also want to say that, this is not to minimize that treatment. For many people, there are always going to be people who don't have the time or energy to engage in the deep process of psychotherapy. And there are many patient populations for whom the sort of, medicine only approach might be best. Um, so back to your question, there are just far greater numbers of those sorts of clinics around the country, um, doing infusions and offering that sort of short, direct sort of treatment. Because of the labor and the hours involved in doing ketamine-assisted psychotherapy, I think there are fewer numbers of those sorts of clinics and fewer numbers of us offering that. So therefore, smaller patient population really having access to that and benefiting from that.
I see. And just maybe anecdotally, if you could tell us about the results that you've seen between the patients who just do the ketamine therapy without the psychotherapy versus the patients that supplement the therapy with the psychotherapy aspect.
Yeah, so I, I estimate, and there's some data to back this up, that in either case, you're getting about 80% of people who respond to ketamine therapy, whether it's ketamine alone or ketamine plus psychotherapy. What the data have also shown is that with the ketamine only group, once people stop getting their infusions, there is a return to baseline, meaning a return to their level of depression and functioning before they started ketamine. So in that model, people do need to return for ketamine infusions on a fairly regular basis. So what we're hoping with ketamine-assisted psychotherapy is that people can go longer between their maintenance doses, and that people get a more sustained effect, that if they were to stop the treatment, that they wouldn't necessarily return to baseline, or they would still show some improvement. And again, we don't yet have the data to support that.
Awesome. Thank you so much for that.
Mm-hmm.
I'd love to know a little bit more about what are the different ways to get ketamine therapy. I understand that, it's the majority so far has been done in clinics, and sort of in a doctor's office, so to speak. And some also have now been available at home. So if you could just sort of talk through what are the various ways to get ketamine therapy in either of those settings.
So I spoke a little bit about the infusion clinics, and that's really where ketamine therapy kind of started. A lot of those clinics are run by anesthesiologists who are the physician group who have the most familiarity with ketamine, yet in a very, very sort of limited scope, meaning they've worked with it as an anesthesia in operating rooms and situations like that. So that's one route, and you have to go into the clinic to get your infusion, always returning to the clinic for maintenance doses and further treatment. And then psychiatrists have been the group more broadly working with ketamine, doing intramuscular injections, working with it as well in an oral dosing. And the oral dosing can be done with a liquid. At our clinic, we work with a lozenge, a rapidly dissolving sort of lozenge tablet. There are a couple of other oral formulations as well. And then most recently, what came on the market is Spravato, which is a nasal form of ketamine. And again, the way that that's being marketed is that people have to go into the doctor's office. They don't take the Spravato home. They get their administration at the physician's office, and then they stay there. Sometimes it might be in the waiting room. Sometimes there might be another sort of, recovery and rest room that people have. I don't know how COVID is going to be affecting that sort of administration. And the advantage to what we're doing at Polaris is that the lozenges allow for a take-home administration. So the lozenges can be prescribed for people to, once they've been sort of trained and had a few sessions with a therapist, a minimum of 2 at our office, then they're able to do that at home. Now, of course, COVID has changed that because people can't come into the office for those 2 sessions. So we recently have been experimenting and offering ketamine-assisted psychotherapy as purely a remote, take-home experience. but we still require new clients to do 2 sessions online with a therapist before doing the treatment on their own.
I see. Um, Thank you so much for that overview. Can you just tell us a little bit, what is the, I guess, the difference in the experience between the various administration techniques? Sort of what should one consider when they're thinking about, should I go to an infusion clinic and actually get an IV versus intramuscular versus the Spravato versus the lozenge?
Yeah. I think in the infusion clinics, there's going to be a lot of variation. Some of the clinics are set up with multiple people in a single room getting infusions. It's a bit like maybe going to a blood bank where people are lying, next to one another with an IV, a needle in their arm. It's a continuous drip, so they're hooked up to a machine. There's quite a bit of monitoring going on. It's typically a bit more clinical, but there are also infusion clinics that are set up more like perhaps a spa experience, where you have a room to yourself and you're getting your infusion. The advantage to that is it's pretty immediate. As soon as the medicine starts entering a person's bloodstream, a person feels the effects pretty immediately. The oral dosing method that I talked about, the lozenges, takes a bit longer for the onset. So anywhere from 10 to 20 minutes once a person ingests the ketamine through their mouth. So it's a slower onset, and people can still go quite deep with an oral dose. And then the intramuscular injection is similar to the infusion, but a person doesn't have to be continually hooked up to a machine. It's a bit like getting a flu shot or an insulin shot. It's a very small needle, typically done in the shoulder, the deltoid. And again, that onset is quite rapid, usually within 1 to 3 minutes.
Awesome. And what are sort of the effects of ketamine therapy, both during the session when you're still kind of under the influence of the medicine, versus what happens sort of in the few hours to few days to weeks after you get the administration of the ketamine?
Yeah. So ketamine is a unique class of drugs. It's called a dissociative anesthetic. So as I mentioned earlier, anesthesiologists have been using it in a medical setting, since it came on the market in the 1960s. And you can take a high enough dose of ketamine and perform a variety of medical procedures on people. Unlike other anesthetics, which really knock a person out so much to the extent that they need breathing support, ketamine doesn't require that. It doesn't suppress the respiratory system. And this is one of the reasons it's quite safe to work with. Ketamine also, the effect is what we might call conscious sedation. So a person can be out, like their body is completely still, they're no longer aware of their surroundings, but they still have consciousness is still online. So consciously, they're still having experiences. Whereas if you think of other anesthetics, you're out. If you've ever had a surgical procedure, once you start, breathing, having sometimes there's nitrous, or once they administer the propofol or whatever they're using, you're pretty much out. And the next thing you know, you wake up in a recovery room and there's no memory. People don't report having any kind of an experience. But with ketamine, people do have experiences, and they remember those experiences that they've had. And so people report a variety of experiences, time travel, traveling through the cosmos, sometimes speaking with dead relatives, or having near-death experiences. Sometimes the experiences are very positive and blissful, and sometimes they're challenging, and occasionally people have a fearful experience. And again, that's why we think it's so important for a therapist to be there with them throughout the experience, so that they have that sort of support and opportunity to process the experience.
I see. I'm so glad that you brought up the possibility of not such a, positive experience during the therapy, which, a lot of people say that although the experience wasn't very positive during the session, it was very helpful to sort of kind of resolve a certain issue or move through something that they have been avoiding or not addressing later on. But I suppose for people who have not tried ketamine and have not sort of had that experience and might have that as a concern, what would be kind of your comment or a word of advice from your experience?
Yeah, I realized that there was a piece of your previous question I didn't quite touch on, and I'll answer the current question by starting there. Um, for people who come into our clinic or any infusion clinic who are severely depressed and sometimes even suicidal, the effects of ketamine, and this is the really incredible thing about working with it, the effects can be quite immediate. So if you think about a typical antidepressant, that can take weeks to sometimes even months for it to work and for a person to feel better. And sometimes suicidal thoughts increase during that time. And a person with a single ketamine treatment can no longer be suicidal, can report a subjective and an objectively measured improvement in their level of depression. So, and that effect will go on for, if they just have a single treatment, that might last for 2 or 3 days, and then they'll kind of come back to where they started. So that's why there's a need for multiple treatments. So to your other question, yeah, people often, there's so much misinformation out there about a psychedelic experience or non-ordinary states of consciousness. And so during our intake process and during our preparation before people have exposure to the medicine, we spend a lot of time helping them feel comfortable, making sure that they know their safety is our main priority, addressing any concerns about anxiety that they have. And we always start people at a low dose and we go slowly. It's like the analogy of sort of wading into the pool as opposed to jumping into the deep end of the pool. So we never want to overwhelm or frighten anyone. Now, having said that, yeah, not all experiences are blissful. But the way we approach that is that whatever comes up during the experience is what needs to come up. And it's coming up for a reason. And challenging is not bad. And so if challenging material comes up, then we want to support the person to go towards that and to kind of stay with that over time, developing a larger and larger capacity to hold challenging or painful or difficult experiences.
Thank you very much. Thank you. We've touched on this throughout the interview already, but maybe just going in more detail about what are the advantages of working with a psychotherapist alongside the ketamine therapy, and where can one find a clinic or can find a ketamine assisted psychotherapist that can support them in this type of therapy.
Mm-hmm. Yeah, so again, our model is, we didn't create this. Everyone at our clinic was trained by Phil Wolfson and Julaine Andrews, who have been pioneers in this work. And their work was based on the early work of psychedelic researchers starting back in the 1950s. And so psychedelic therapy was never really meant to be, take a pill on your own or take a substance on your own and there you go. The support staff, whether it's a facilitator or a shaman or a therapist, has always been an integral part of this. And we think it's very necessary to support people during the experience. So even with the at-home, once people begin at-home sort of solo treatment, the therapist is still part of that team. They always have access to the therapist, and we require a person to maintain contact in order to continue their prescription. So, we think it's an integral part of the healing process. And the other piece of that is that, healing does not happen in a vacuum. All of our healing happens in relation to other people, whether that's, family of origin, or chosen family, our tribe, if you will, a spouse. There are people in our lives. We don't live in siloed and, vacuums. And the relationship between the client and the therapist is another form of that. So that healing happens in relationship as well. And then I
Awesome.
got off
The
track.
other question
Part of
is
your question, yeah.
where can
Oh, yes.
where can
Most
a person
importantly.
find, if they wanted to take sort of the next step in this, where would they find a psychotherapist that could help them with ketamine therapy?
Yeah, so certainly contacting us if they're in the Bay Area or anywhere in California now that we've expanded our available treatment options, and that's polarisinsight.com. Dr. Raquel Bennett, another pioneer in ketamine therapy, maintains a wonderful website, KRIYA, KRIYA, the KRIYA Institute. And on her website, she has a list of resources available, and that's more nationwide and I believe even international. She had been running a ketamine conference for several years. And so researchers from all over the world came to that conference, and many are on her list of resources for treatment. Also in the Bay Area, there's Sage Institute, Healing Realms. I mentioned Dr. Phil Wolfson. So those are some places to start. And most of us, if we're not able to take a person on, we will help with referrals based on where that person is located.
Awesome. And I guess more about sort of a protocol, or a regimen through which a patient goes through. And as far as I understand it, obviously depends on the condition and the person and what kind of situation they're in. But if you could just tell us about what are some of the existing protocols out there.
Mm-hmm. Yeah, so I'll talk about ours, and our protocol is based on probably the most widely used protocol, which was certainly supported by data. So after a very thorough intake process and then preparation, when people start their treatment, the goal is to have 6 sessions within a 2 to 3 week window. And the data suggests that having that sort of condensed treatment kind of jumpstarts the process, exposing the brain, if you will, to the chemical process, and also jumpstarting the therapy. It's many hours spent together. And then after those 6 sessions, then the person transitions into kind of a maintenance phase. So the first 2 or 3 weeks are quite intense with these treatments. If we think that each treatment is about 3 hours long, so it's a big time investment up front. And then, like with any therapy, once you start, things can come up. I mean, we want things to come up, right? We're trying to heal. So it can be quite intense. And then the person transitions into a maintenance phase. For many people, that's 1 session once a month. For other people, it might start off a weekly session, then every other week. Gradually, the goal is to gradually increase the time between maintenance sessions. It's not our intention or desire to just get someone kind of dependent on another medication, but that the medication, and again, the great thing about ketamine is you don't take it every day, so a person can sort of space out these experiences.
I see. So it's I suppose there's sort of what makes ketamine great, right, is that there are 2 things happening. There's sort of a change in the chemistry of the brain, right, which gives you sort of a anti-depressant effect. And there's also kind of the ability to see certain things issues that or challenges that one is working with from a different point of view, or allowing things to come up, as you said. So I was just wondering if you had any comment as to, um, you know, it's difficult to say, I guess, a percentage of, in one's healing journey, what's what's the responsibility of the kind of the change in the chemistry that ketamine provides versus kind of the ability to like see issues in a different way and reframe them.
Yeah, yeah. Hmm. It's a great question, and I wish I had a definitive answer for you. Um, I think this is one of those things. It's kind of one of the great mysteries. It's a beautiful synergy when it happens, and both pieces are important. Um, I could guess it's a 50-50, but I think there's enough data to show that even when people have only the medicine, they benefit from it. So maybe there's a greater contribution on the medicine side of that equation. I don't know if that's 60% or 55% or what it might be. But I think it's, the magic really happens in that synergy, and there's the medicine and the therapy. We talk a lot in psychedelic medicine about set and setting, and that's also a very important part of that equation. So I'll have to be
Awesome.
a bit vague in my response.
Absolutely. Yeah. Thank you for that.
Yeah.
So what kind of conditions is ketamine therapy used for?
Yes, it's gotten most of the press has been focused on treatment-resistant depression. So people who've basically, often we have people coming in who say they've tried every antidepressant on the market. They've been in therapy for years. They've tried all kinds of therapy, sometimes electroconvulsive therapy or transcranial magnetic stimulation. They've tried everything, and either nothing has worked or it stopped working. So depression is kind of the main thing. But trauma and PTSD is that we see a lot of people, and even people who come in reporting depression, once we really start to kind of get into the process, it's not uncommon that trauma is uncovered, that people never thought of as trauma before in their lives. Obsessive compulsive disorder and other anxiety concerns, chronic pain, although that's not a focus of treatment at our clinic, and addictions. Interestingly, ketamine is showing to be very effective at treating substance use disorders and addictions. So those are some of the main diagnoses that it's effective for.
I see. There's also
let me throw in
yeah.
one more thing. People often ask about this. What about bipolar disorder? Bipolar disorder is is an increasingly diagnosed disorder. And yes, it's effective with bipolar disorder, with caution. People come in during kind of a depressive phase. It can be quite effective. When people are hypomanic or in a more manic phase, we want to be careful, because having a dissociative experience can then, exacerbate or even precipitate a manic episode.
I see. And how about healthy individuals that are looking for sort of personal development or, spirituality growth?
Yeah. Mm-hmm.
Have you seen this happening, and, sort of what's the response in the kind of medical community to that?
Yeah. I have to preface that question by saying that, unfortunately, because of prescribing requirements and DEA regulations, it's not something that we're able to offer at Polaris. And that will be the stock response you'll get from most medical professionals. Because unfortunately, the way our system is set up, we don't give medicine to people who are well. So, it's not a vitamin or a supplement. However, on a, more personally, I think, yeah, it can be incredibly beneficial for that sort of personal growth and spiritual exploration, as can all psychedelics. And, that is one of the, debates in the psychedelic research and therapy um, community right now, is that, there are many people who believe, yeah, if why can't well people get weller? Um,
Yeah.
People who are doing well be doing even better. And, that fits quite nicely with kind of the nootropics and, life hacking kind of approach to things, that these substances can help us in many ways. It's not just about curing disease, but, we need to change our drug policy laws, and certainly the way that medications are scheduled within the DEA framework, in order to really utilize these medications to their full potential. And I hesitate to say medications then, because that's connected with a disease model.
Yeah. So the whole framework, I suppose.
Yeah.
So uh, I guess, sorry, this is kind of a surprise question, but um, I think there's a large population who is struggling with one of the conditions that ketamine therapy has, shown great efficacy for, but the population is not familiar and probably has a very negative view of ketamine because they know it as K, right? So as a street drug that has become widely popular and is a drug. So, I think that has been working against, the ability of a lot of people to seek out this, medicine and be able to get better. So, I mean, I'm sure that you've kind of heard this from some of your patients, the concern that they have, and I was just wondering if you have a response to that.
Sure. Yeah. I mean, ketamine certainly has a bit of a PR problem, maybe in the same way that LSD does. And most of that is due to misinformation and urban legend and urban myth. But I will, also say that yes, ketamine is a very powerful medicine, and when used improperly, can be, you know, it's safe, as I mentioned. No one's likely to overdose from ketamine. That's very, very rare. Um, but it can be psychologically unsafe. So if people are doing ketamine in a social setting at a club, people can often have quite frightening experiences. Um, then you know, as a scientist practitioner, I'm quite keen on the data. So then to point people towards the data. Well, this is what we know about ketamine, and when used properly, when used safely, when proper attention is given to set and setting, it can be incredibly healing and incredibly helpful. And on the other side of that, all medications have a dangerous side to them, right? So we
Absolutely.
have an epic, another pandemic in this country with opiates and benzodiazepines as well, and people aren't nearly as reluctant to take those. So
Absolutely.
ketamine,
Thank you
I'd
so
say,
much.
is much safer than those.
Yeah, absolutely. So I guess let's move on to sort of more around Polaris,
Mhm.
the ketamine-assisted therapy clinic that you have founded. Can you tell us more about Polaris? What's the mission? A little bit more about the team and sort
Mhm.
of the step-by-step patient experience that you guys provide.
Yeah, so as I mentioned earlier, we all work on the MAPS study as well. So there are five of us, five co-founders, four psychologists and therapists, and then our medical director. And we all really kind of met during our training to work on the MAPS MDMA for PTSD trial. And like I said, we were so inspired. We really wanted to start doing this work. And we all also, I would say, almost immediately had a very natural affinity and love for one another. And we felt very confident that we could come together as a team and build something, really beautiful and sustainable. And so that's what we've done at Polaris. And our setup is in an old Victorian building in the Castro neighborhood of San Francisco. So coming to the clinic, people often say, wow, it's so homey and so comfortable here. So our treatment rooms feel very much like maybe your living room, very, very comfortable, and we pay a lot of attention to the setting at the clinic. So everyone is, our staff are very well trained on working with trauma and other issues that come up. We've been slowly expanding and bringing on additional therapists as well to do the work so that we can see more people at our clinic. Yeah, so I'd say people can expect a lot of individualized attention, and when they come to our clinic, they can expect to be held and nurtured, if you will, throughout their experience.
Awesome. Thank you so much. And I guess my final question is, how can kind of the community support you?
Yeah, I think one of the best answers to that is, one of the challenges with this work, because it is so labor intensive, is making it more widely available to larger numbers of people, particularly to communities of color and communities who who suffer from economic inequality and injustices. And so, we do offer sliding scale fees. I mentioned Dr. Wolfson earlier. He has a foundation set up where people can donate money, and then he distributes that money to help pay to offset the costs associated with that. But in Sage Institute that I mentioned earlier, they've also have a treatment fund for this. And so Polaris we're moving in the direction perhaps of a nonprofit, a way that we can offer this treatment to more numbers of people. So I would say, one, spread the word, and if people are able to get in touch with us and donate so that other people can have access to this service. And I would say another really important way is support drug law reform. Get involved in that. Psilocybin is likely to be on a statewide ballot soon. Educate oneself about that. Get involved with the decriminalized nature movement. Learn more about that, and let's destigmatize these important allies.
Awesome. Thank you so much. Greg, this was
Thank
wonderful. Thank you again. Wonderful.
Yeah, thanks, Dina.